Supplements have become a significant part of many people's daily routines. While they are essential for filling nutritional gaps in the diet, it's important to remember that supplements cannot replace a healthy, balanced diet. However, using them improperly can lead to ineffective results or even harm your health. In this video, we'll explore 11 common mistakes people make when taking supplements and how to avoid them, ensuring that you get the most benefit from your supplementation. 1. Timing your supplements incorrectly. One of the most common mistakes people make is not paying attention to the timing of their supplements. Taking the wrong supplement at the wrong time can reduce its effectiveness or cause unwanted side effects. For example, some people take vitamins and minerals all at once, not considering how the timing impacts absorption and effectiveness. Personally, I recommend taking most of your supplements in the morning. This is when your body is ready to absorb nutrients and can make the most use of the vitamins, especially those involved in energy production, like B vitamins and magnesium. Additionally, taking supplements earlier in the day ensures that you are energized and able to get the most out of your day. I follow an intermittent fasting schedule where I consume 2 meals, breakfast and a late lunch, skipping dinner. This allows me to have energy throughout the day, as I am not consuming food late at night, which would be counterproductive before sleep. It's crucial to listen to your body and adjust your timing according to your needs. A common mistake is taking electrolytes before bed. Electrolytes such as potassium, sodium, and magnesium play a crucial role in hydration, but consuming them late in the day can push fluids out of your body, leading to dehydration during sleep. For vitamin D, some people benefit from taking it in the morning, while others find that it helps them sleep better if taken before bed. There's no one-size-fits-all answer, so feel free to experiment with timing to see what works best for your body. However, a critical point is to take calcium supplements at least 30 minutes before meals to avoid interfering with stomach acid production, which can inhibit digestion. 2. Swallowing too many supplements at once. Another common mistake is taking multiple supplements at once, especially in large quantities. I've been guilty of this myself in the past. There was a time when I decided to try a gallbladder flush that involved taking beetroot supplements and a large amount of olive oil. I swallowed a handful of beetroot capsules with 12 ounces of olive oil, which led to my capsules getting stuck in my esophagus and causing extreme chest pain. It felt like I was having a heart attack, and I seriously thought I might die from taking supplements. Taking too many supplements at once can lead to discomfort or even more severe complications. If you need to take multiple supplements, break them up into smaller doses throughout the day. This will not only make it easier for your body to absorb the nutrients, but also reduce the risk of digestive distress. A more gentle approach involves taking your supplements with meals. When you eat, your body produces more digestive enzymes and stomach acid, making it easier to break down and absorb the nutrients from the supplements. 3. Introducing too many supplements at once. Trying to solve a health problem by introducing multiple supplements at the same time can be counterproductive. If you suddenly start taking several supplements to address an issue, you won't be able to determine which one is working. It's essential to introduce new supplements one at a time so you can track their effects and identify what works for you. For example, if you are trying to improve your energy levels, don't take a B vitamin complex, magnesium, and vitamin D all at once. Start with one supplement and assess how your body responds. If you notice positive changes, keep using it. Otherwise, introduce another supplement and monitor its effects. 4. Assuming supplements can compensate for a poor diet. One common misconception is that supplements can compensate for a bad diet. For example, I've personally experienced this mistake. I used to eat a lot of refined carbs and not enough protein, particularly at breakfast. No matter how many vitamins I took, I still felt tired and sluggish. The problem wasn't my vitamin intake, it was my macronutrient balance. Once I started incorporating more protein into my diet, I noticed a significant improvement in my energy levels. Supplements cannot replace the nutrients your body needs from whole foods. If you have a poor diet, high in processed foods, and low in essential nutrients, no amount of supplements will fix the underlying issue. Instead of relying on pills, focus on improving your diet with whole, nutrient-dense foods like fruits, vegetables, lean proteins, healthy fats, and whole grains. 5. Choosing cheap, low-quality supplements. Many people make the mistake of choosing the cheapest vitamins they can find. It's tempting to buy low-cost, mass-market supplements, but these are often of poor quality. For example, some calcium supplements contain calcium carbonate, a type of calcium found in cement. The lower the cost, the more likely the supplement is to be filled with synthetic ingredients, chemical additives, and artificial colors. These cheap supplements might not be effective or could even harm your health in the long term. When choosing supplements, make sure to look for high-quality brands that use bioavailable forms of vitamins and minerals. For instance, opt for vitamin D3, cholecalciferol, rather than D2, as D3 is more effective in raising vitamin D levels in your body. Be cautious with synthetic antioxidants like beta-carotene, as some studies suggest that synthetic forms could increase cancer risk, although natural forms from food sources don't carry this risk. 6. Not considering drug supplement interactions. Another serious mistake is not considering the potential interactions between supplements and medications. Some supplements can enhance or interfere with the effects of prescription drugs, leading to unintended consequences. For example, if you are on medication for high blood pressure and start taking a supplement that also lowers blood pressure, such as magnesium, you might end up with dangerously low blood pressure. Always consult your doctor before combining supplements with prescription medications. For example, people taking metformin for diabetes often benefit from taking berberine, a natural supplement that has a similar effect. By working with your doctor, you may be able to reduce your metformin dosage and rely more on the natural supplement, which may have fewer side effects. When taking antibiotics, it's crucial to also take probiotics to help replenish the good bacteria in your gut. Antibiotics can destroy beneficial gut flora, so supplementing with probiotics during and after your antibiotic course will help restore balance in your digestive system. 7. Ignoring nutrient interactions. Certain vitamins and minerals need to be balanced with others to work effectively. For instance, high doses of vitamin D require magnesium to activate its beneficial effects. Without magnesium, your body cannot properly utilize vitamin D, which may lead to symptoms like fatigue or bone pain. Similarly, long-term high doses of zinc can deplete copper levels, leading to deficiencies. Be mindful of the interactions between minerals like sodium and potassium. Consuming too much sodium without enough potassium can lead to electrolyte imbalances, which could result in issues such as muscle cramps or high blood pressure. When taking supplements, it's better to choose a blend that includes a range of minerals and trace elements to ensure you don't create an imbalance. This approach minimizes the risk of deficiencies or adverse interactions. 8. Relying on unqualified advice. Many people turn to friends, family, or influencers for advice on supplements, but this can be problematic. Just because someone recommends a supplement doesn't mean it's right for you. It's essential to seek advice from professionals who have a deep understanding of biochemistry and nutrition. Dietitians, nutritionists, and doctors are trained to provide evidence-based guidance that takes your specific health needs into account. Similarly, when researching supplements, avoid relying on anecdotal evidence or advice from sources without scientific credentials. In many cases, recommendations are based on personal experiences, not rigorous studies or clinical trials. 9. Taking inadequate dosages. Many people make the mistake of taking too little of a supplement. When it comes to vitamins like vitamin D or B12, the recommended daily allowances, RDAs, are often set too low to have a therapeutic effect. For example, the RDA for vitamin D is 600 IU, but studies have shown that higher doses may be necessary to support immune function and maintain optimal health, especially for those living in northern latitudes or people with conditions affecting nutrient absorption. Genetic factors can also affect your ability to absorb or metabolize certain nutrients. Many people have genetic variations that make it harder to absorb vitamin D, so they may need to take higher doses to achieve optimal levels. It's always advisable to consult with a healthcare provider to determine the right dosage for you. 10. Not considering the needs of special diets. If you follow a vegetarian or vegan diet, you're more likely to be deficient in certain nutrients, such as vitamin B12, vitamin D, omega-3 fatty acids, iron, and calcium. Supplementing with these nutrients is essential for maintaining overall health, as plant-based diets may not provide adequate amounts of these vitamins and minerals. Vegans should consider taking a vitamin B12 supplement, as it's found almost exclusively in animal products. Omega-3 supplements derived from algae are a great plant-based alternative to fish oil, and vegan-friendly vitamin D3 is available from lichen sources 11. Not taking vitamin D seriously. Finally, vitamin D is one of the most commonly deficient nutrients worldwide. Vitamin D is crucial for immune health, bone health, and overall well-being. Unfortunately, it's difficult to obtain sufficient vitamin D through food alone, and many people don't get enough sun exposure to produce it naturally. For most people, maintaining adequate levels of vitamin D requires daily supplementation. While the recommended daily dose is often 600 IU, many experts suggest that a maintenance dose of at least 4,000 IU is necessary for optimal health. Some studies even suggest that doses as high as 10,000 IU per day may be safe and effective for addressing deficiencies and supporting immune function. Supplements can be a great addition to your health regimen, but it's important to use them correctly. By avoiding these common mistakes and following the tips outlined above, you can maximize the benefits of your supplements and improve your overall health. Always remember to consult a healthcare provider when making changes to your supplement routine, especially if you have existing medical conditions or are taking prescription medications. Taking supplements is not a substitute for a healthy diet, but when used appropriately, they can be a powerful tool in supporting your health. Keep in mind that quality matters, timing matters, and dosage matters. Educating yourself and making informed decisions about supplementation will ensure you're getting the best results for your health.
If you enjoyed this video, hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching.